Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started.
Dr. Derian, thank you so much for being here. It's such a pleasure to have you. For those who are listening who don't know who you are, tell us a little bit about yourself and your practice.
Sure. I'm Armin Derian. I'm an interventional pain physician, background in physiatry. I work at Saguaro Pain Clinic, where we do both regenerative medicine and pain management traditionally. We do a lot of personal injury and work comp, and that's probably our forte.
Excellent. How long have you been doing pain management work?
About 8 years.
And where are your clinics located?
We have East Mesa location, Tempe, and Phoenix.
Excellent. Now, do you do a lot of personal injury cases?
Yes, that's the bulk of our practice.
Excellent. So tell us a little bit about the services that you provide for personal injury patients.
We are MD providers. There's 3 of us, so we do both the initial consultations as well as the interventions on the back end if necessary. If they're not improving with conservative management, we can inject them and hopefully get them there without surgery.
Sure. What types of injections do you provide?
We perform all kinds of spine injections, epidurals, nerve blocks, ablations. We also do peripheral injections, joints, shoulders, hips, knees. We treat headaches with injections, whether it's in the neck or the head. Pretty much everything, head to toe, we can inject.
Sure. Now, we've had cases together, and every case that we've had in common always had a chiropractor attached to it. So what has your relationship been in collaborating with chiropractors on personal injury cases?
Our relationship is very reciprocal. We are not a replacement for the care they provide. It's a conjunction. It's all in conjunction. So the injections work better when they're followed up with therapies and vice versa. Mm-hmm. So it's a very mutually beneficial relationship.
That's great. That's excellent. I always like to have a nice referral network in place or different specialties. And we decided to put on a large conference in January with a multidisciplinary approach. And you're going to be on that multidisciplinary panel representing pain management. So tell us what you're looking forward to the most for that.
I'm looking forward to introducing Saguaro's services to all of those people in attendance and hopefully making us one of the biggest players in the pain management world.
Sure. Now, the bulk of the attendees are going to be chiropractors. So what type of information do you really want them to take away with when they're learning about Saguaro pain?
That our services can go hand in hand with what they're doing and not be instead of what they're doing. That we can start pain management earlier on in a case and not necessarily once their therapies have been exhausted.
Excellent. Well, tell me a story, one of your greatest success stories as a pain management physician.
One of the greatest success stories was a commercial case, college student, compression fracture. Because of the location of the compression fracture, it was in the upper thoracic spine. Other pain physicians wouldn't touch her, and rather than doing the standard approach of vertebroplasty or kyphoplasty, I just said let's treat this young patient with a more conservative approach, an ablation at the levels above and below, and sure enough, her pain 90% better, 100% better, and we avoided a surgical procedure.
That's amazing. Tell me a little bit about ablations. What is an ablation?
An ablation, so when we have like a really bad whiplash or in cases of chronic arthritis, the sensory nerves of the spine provide pain, and so we block those nerves, and when the blocks are successful in relieving the pain, we can do an ablation where the tip of the needle heats up and cauterizes those nerve endings so that they have longer term relief, like for 6 months or a year, and hopefully they do enough therapy in that interim that the pain won't come back and be a chronic syndrome for them.
So it's common for you to work with physical therapists and chiropractors. Yes. At the same time.
Right. Even in non-PI cases, I always recommend patients to follow up with physical therapy, core strengthening, etc.
Sure. What are some of the fears you find people have when it comes to doing pain management?
Fear of needles. Nobody wants to get injected. So we do a good job of locally anesthetizing them and also offering IV sedation where you get a little happy juice, you sleep for 5 minutes, you wake up when we're done, you don't feel or remember anything.
Obviously, you have to refer out certain cases when you find certain injuries. So let's talk about a typical case that you would refer to a neurosurgeon. So what would that look like, and walk me through that process?
Right. So if the say the herniation is severe, more than just mild or moderate, and they have weakness or any bowel bladder changes, that's kind of an emergent referral. Right off the bat, we're not going to wait to inject that patient and wait for a month or two before referring them out. It's going to be right away. And, if the surgeon doesn't think they need surgery, then great, they come right back to us. Otherwise, at least they're taken care of and they're not going to have long-term complications.
Sure. Does a lot of your work rely on the data that comes from imaging studies like an MRI?
Yes. Objective exams are really good, whether it's physical exam or imaging. It helps almost as much, if not more, than the subjective complaints.
If you have a doctor who's debating whether or not to order an X-ray or an MRI when treating a trauma patient, what would your recommendation be?
Both, and MRI early on, because
Why is that?
The acute findings sometimes will dissipate over time. So if we wait for a month or two before getting the MRI, you may not see some of those acute inflammatory changes after an accident.
So it's all about the documentation. You want to make sure you get those acute findings early on and get them documented before the evidence is destroyed and it goes away. So in the legal world, we call that spoliation. And so it's great that you do that and you stay on top of that. So are there any tips that you could give chiropractors when they're thinking about working with your office for pain management? What would you want them to know about your clinic?
I would like them to know that we are very collaborative, that we will reciprocate the patient care experience. We're not going to steal their patients. We're definitely going to send them back, and we want to work with them, not against them, obviously.
Sure.
So, along with that, if they have ordered any imaging studies prior to the referral, we'd appreciate sending them with the referral. It kind of helps expedite things on our end.
Excellent. Well, that's great. And it's really important that you have that relationship with the chiropractors and are able to put forth a collaborative treatment plan. And I'm assuming you're doing so well that it's been successful.
Right. I mean, we've been doing this for 7 or 8 years, and every year it's growing. Hopefully we have our third location now in Phoenix, and we're hoping to go to Tucson next. So
that's great.
Look out for that next year.
Absolutely. All right. So you got a patient who's thinking about doing pain management. They get the referral from the chiropractic. What is something you would want that person to know when they're deciding which pain management clinic to go to? What would you want them to know about Saguaro Pain?
We're like a family at Saguaro. We treat everyone like family, whether it's our own family or friends, or a personal injury case, or an insurance patient, or a Medicare patient. We treat everyone the same when it comes to providing pain management, and the immediate relief they get is more than just from the shots. It's from that comfort of knowing that they're in a concierge, familial setting.
Sure. Well, it's been such a pleasure working with you over the years, and it's been awe-inspiring how fast your practice is growing in multiple clinics. Now you're moving down to Tucson, so clearly you're doing it right, and we wish you all the success in the world. And
thank you for all the advice along the way as well.
Oh, it's my pleasure. You guys have been great to work with. You have a very well-trained staff, always very courteous to my clients. The care you've provided has always been top-notch. So we're very lucky and privileged to work with a provider that puts that time and attention to detail into each case. So thank you so much for everything you do. Thank you for your contributions to the personal injury world and making our jobs easier when we go to battle against the insurance companies.
Right. Thank you. Thanks for having me.
You got it, man. Thank you.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most. their loved ones, and the life they deserve. This is the Chiropractic in Legal Injury podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this podcast with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.